The common terminal illnesses in long-term care tend to be cancer, dementia, stroke, heart failure, kidney failure, and then COPD or chronic bronchitis.
Discuss factors that affect attitudes about death in a long-term care resident.
I think that when I talked to this about with the chaplain said he thought more than age, the thing that affected it were life experiences. How you have experienced death of loved ones, what type of illnesses they had, what kind of pain they went through prior to death. Death among very young, of course, is always very traumatic. But I find that most of the people in long-term care have an acceptance of death as part of the life cycle. Now, the older they get, the closer they get to being 100, the more infirm they become. I think that really, they're more accepting at that time. I think that the young people are afraid of death. They see it as very negative, as very tragic at any time. I think that as you progress and live life and see suffering, then I think as we got older and middle age, we start looking at it a little bit differently. We're still not ready to die at that time. But then as we get progressively older and we start seeing our friends and family leaving, there's that loneliness and your really desire to see those people. And a lot of things that affect your attitude on death is your culture. And many cultures believe in reincarnation. You know, they think that they're coming back, so death at any age is not viewed as something to fear. The one thing you have to do in long-term care or any kind of setting that involves medicine is be ready to provide that care, spiritual care for them when they near death. So you have to know your patients and know your residents.